Imagine this. A nurse at a major hospital shows up for her shift and finds out her team's dedicated phlebotomist, the expert who handles every single blood draw, is gone. The official line: department restructuring for efficiency. That nurse's job just got harder, more stressful, and a lot more dangerous for her patients. For the nurses watching, does this sound familiar? Let me know in the comments. Hospitals all over the country are making a change they hope you won't notice. And it's pushing nurses to the absolute edge. This isn't about improving care. It's a cost-cutting move in disguise. And it's one piece of an alarming trend that's dismantling our healthcare system. Today, we're talking about why hospitals are firing their phlebotomists and why anyone who might need a hospital bed one day should be paying very close attention. For years, phlebotomists have been the unsung heroes of the hospital. You nurses tell me. They're specialists with one critical job: to draw your blood quickly, painlessly, and safely. They have a level of skill that only comes from thousands of hours of practice, finding that tricky vein on the very first try, calming a nervous patient, and making sure every sample is perfect so the lab results are accurate. They are a crucial part of figuring out what's wrong with you. But on hospital floors across the country, these specialists are starting to vanish. It's not because of some new robot that makes their job obsolete. In fact, demand for phlebotomists is expected to grow. That highly specialized work is being dumped onto the already overloaded shoulders of bedside nurses. Yes, nurses do know how to draw blood, but phlebotomists are specially trained with thousands of hours. Hospital systems have been doing this for years, cross-training nurses to take on phlebotomy under the banner of patient-focused care. And more recently, widespread layoffs at major systems like Providence Swedish and UC San Diego Health have left the remaining nurses to pick up the slack from all kinds of eliminated support roles. They call it role consolidation. They call it efficiency. But what it really is a dangerous gamble with nurse burnout and your safety. It pulls back the curtains on the dark truth about priorities of modern healthcare. Let's break down what this really means for all of us. The first and most immediate result of getting rid of phlebotomists is a massive workload increase for a profession that is already at a breaking point. The American healthcare system is collapsing under the strain of catastrophic nursing shortage. Projections for 2026 show the country is short about 8% of the registered nurses it needs. That's a gap of over 263,000 nurses. Some states are facing deficits of over 36,000 nurses all by themselves. Nurses are retiring in huge numbers, with 1 million expected to leave by 2030. And nursing schools are turning away tens of thousands of qualified applicants every year because they don't have enough faculty or resources. Into this full-blown crisis, hospital administrators are now shoving another complex, time-consuming duty. Drawing blood isn't just a quick poke. It's not. It means tracking down the right supplies, confirming the patient's identity, skillfully finding a vein, drawing multiple tubes in a specific order, labeling them perfectly at the bedside, and getting them to the lab. For a healthy patient, that might take 10 to 15 minutes. But for a patient who is elderly, dehydrated, or chronically ill, it can easily turn into a 30-minute ordeal for both the nurse and the patient, sometimes requiring multiple painful attempts. Nurses in the audience, I have to ask, what's the longest you've spent trying to get a difficult stick on an understaffed shift? Share your experience down below. Inquiry minds want to know. Now, multiply that by the 8, 10, or even 12 patients one nurse might be responsible for on an understaffed floor while they're struggling to get a blood draw on one person. Another patient's pain medication is late, a family member has an urgent question, and a critical alarm is blaring down the hall. Adding blood draws to this chaos isn't just adding one more thing to a to-do list. It's adding a huge source of delay and stress that messes up their entire shift. It forces nurses to make impossible choices about where to put their attention. A 2026 report revealed that 74% of nurses felt emotionally exhausted multiple times a week. Piling on more work without more time, support, or pay isn't just unfair, it's completely unsustainable. So why on earth are hospitals doing this? The official line they're selling is that it's for efficiency and patient-centered care. The idea sounds nice in a marketing brochure. The nurse does everything for the patient, so the process is more streamlined and the patient only has to deal with one person. Sounds great, right? But let's be real. This is almost always a smokescreen for aggressive cost cutting. Hospitals are businesses, and lately they've been under huge financial pressure from rising labor costs, inflation, and insurance reimbursements that don't cover the true cost of care. In this environment, executives are hunting for any way to trim the budget, and staff is often the first thing on the chopping block. Phlebotomists, as a specialized support department, aren't seen as an asset to patient safety, but as a cost center on a spreadsheet. Wiping out the entire department and forcing nurses to absorb the work looks like a big financial win on paper. What are your thoughts on that? This is part of a much bigger, more destructive trend of consolidation, where all kinds of specialized support roles are being eliminated. We've seen it happen with layoffs of certified nursing assistants, unit secretaries, and patient transporters. Each time the logic is the same: cut the non-essential role and have the higher paid, more versatile nurse pick up the work. I'm curious for the nurses watching though. What other support roles have you seen disappear from your units? Is it just phlebotomy, or is this happening across the board? The problem is this definition of efficiency is dangerously short-sighted. It counts the dollars saved, but completely ignores the hidden costs. The cost of nurse turnover, the cost of medical errors, and the cost of plummeting patient satisfaction. The so-called efficiency gained by saving a phlebotomist's salary vanishes the second a burnt out, overworked nurse makes a mistake or quits the profession for good. I've seen this happen firsthand, and I know many of you watching have too. It's incredibly frustrating and demoralizing. I'd love to hear what you think is going on in your area. Have you seen phlebotomists or other support staff disappear from your hospital? Tell me your story in the comments below. And if you're getting some value out of this, please hit that like button and subscribe for more content that pulls back the curtains on what's really happening in healthcare. This brings us to the most important reason everyone should be worried: the direct threat to patient safety. Phlebotomists are masters of their craft. Their single focus makes them incredibly good at what they do. They know all the tricks for a rolling vein, how to use a dedicated butterfly needle on a fragile hand, and how to keep a patient from panicking. Their expertise means less pain, fewer sticks, and lower risk of ugly bruises or blown veins. A nurse, while a rock star in 1,000 other ways, is just not a full-time phlebotomist. When they are rushed, stressed, or juggling 5 other priorities, the risk of a mistake skyrockets. Yes, studies show that giving nurses dedicated phlebotomy training can help reduce lab errors. of course, but that doesn't account for the reality of an understaffed unit where a nurse is being pulled in 10 different directions at once. For the nurses out there, I can only imagine the fear of making one of these mistakes when you're stretched so thin. What's your biggest safety concern when you're forced to juggle tasks like this? Drop them in the comment. I would love to hear it. The potential for error is huge. A blood sample drawn in the wrong order of tubes can contaminate the sample with additives, mess up the test results, and lead to a completely wrong diagnosis. A mislabeled tube can be catastrophic, giving one patient's critical lab results to someone else. A damaged or hemolyzed sample from a difficult draw has to be thrown out, meaning the patient has to be stuck all over again, delaying critical results for hours. These aren't just hypotheticals. They happen every single day when a nurse is trying to draw blood, while also listening for a bed alarm, answering a call light, and getting meds ready. Their focus is split. That's how mistakes are made. We already know that healthcare staffing shortages are directly linked to worse patient outcomes, like higher rates of hospital-acquired infections and even an increased risk of death. Removing a key support role like a phlebotomist only makes these dangers worse. Trading the proven expertise of a specialist for the divided attention of a generalist isn't a recipe for safe quality care. It's a gamble, and the patient is the one who pays the price. And finally, this trend points to something deeper and more corrosive. The healthcare system's devaluation of specialized expertise. In the relentless push to cut costs, the system is moving toward a model where everyone is seen as interchangeable. By treating phlebotomy like a simple task that can just be tacked onto a nurse's job description, hospitals are ignoring the fact that it is a genuine profession. It requires specific training, certification, and thousands of hours of practice to master. This mindset is an insult to the phlebotomists who dedicate their careers to this skill. And it's dangerous for the nurses who are suddenly expected to become expert in yet another discipline overnight. It creates a system where nurses are becoming jacks of all trades, but masters of none. Constantly pulled away from their core duties of assessing patients, planning their care, and providing education. If you're a nurse, how does it feel to be treated as a jack of all trades? What are the core parts of your job you wish you had more time for? True excellence in healthcare comes from a team of specialists working together. A nurse, a doctor, a respiratory therapist, a physical therapist, and yes, a phlebotomist, all bringing their unique skills to the patient's bedside. And when we start stripping away these specialized roles, we weaken the whole structure. The system becomes more fragile, more prone to error, and less capable of delivering the high-quality care that patients deserve. The quiet disappearance of the hospital phlebotomist is a symptom of this larger disease. It's a warning sign that the focus is shifting away from patient well-being and toward the financial bottom line. And if we ignore these signs, we risk waking up one day in a healthcare system that's been hollowed out from the inside with no one left to provide the expert care we all count on. So the next time you're in a hospital and notice your nurse seems rushed while trying to draw your blood, it's not because they aren't skilled. or because they don't care. It's because they're being forced to do the job of two people. The decision to get rid of phlebotomists isn't some isolated event. It is a calculated business strategy playing out in hospitals across the nation, driven by financial pressure and a blatant disregard for the consequences. It buries already overburdened nurses in more work, cranking up their stress and pushing them right out of the profession. It's sold as efficiency, but it is really just short-sighted cost-cutting that ignores the true costs of safety and quality, and it slowly eats away at the very foundation of specialized, team-based care our system was built on. This is not a problem that's going to fix itself. The financial pressures on hospitals, those are real. But trying to solve them on the backs of nurses and at the expense of patients is a catastrophic mistake. If we don't fix the burnout crisis, if we don't stop treating our healthcare professionals like interchangeable cogs in a machine, there may not be enough of them left to take care of us when we need them most. The silent firing of phlebotomists is a blaring alarm bell, and it's time for all of us, patients, families, and providers, to start paying attention. Thank you for watching. If this issue hit home for you, please share this video. Spreading awareness is the first step towards demanding a change. And for all the healthcare professionals watching, please continue to share your stories in the comments. Your voices are critical in showing people what's really going on. And don't forget to like and subscribe and hit the notification bell for more deep dives into our healthcare system. Stay safe and stay informed. This is The Broken Shift. I will see you in the next one. Healthcare culture doesn't change when we ignore it. It changes when we're willing to examine it. This is The Broken Shift.